So I want to talk to you a little bit about narcolepsy and how that can come to neuro-ophthalmology. And normally narcolepsy is a sleep disorder, so it doesn't come to us. However, the way that it can come to us is there are two types, a type 1 and a type 2. In the type 1 narcolepsy, you have cataplexy. So that's the one that's always on the TV and the movies where the person just collapses because they've lost voluntary motor control and they just pass out because they're going to sleep. And so that one is much more dramatic and obvious, the type 1. And you have to have polysomnography. And what we're looking for is the multiple sleep latency test and the sleep onset rapid eye movement. And now you can see where this is going to come to us in ophthalmology. This rapid eye movement can intrude into the wakefulness state. And so the things that can intrude into the wakefulness state can produce hypnagogic visual hallucinations that are quite vivid, and this person is going to fall asleep. And the diagnostic test is the hypocretin, which is the driving biomarker neurotransmitter for narcolepsy type 1. In the type 2, it's a much harder thing to diagnose because they just have excessive daytime somnolence. So both narcolepsy type 1 and 2 have excessive daytime somnolence greater than 3 months. But as opposed to the type 1, the type 2 doesn't have the cataplexy. And so that one is just like a really sleepy person all the time. However, the same diagnostic criteria, multiple sleep latency tests show onset less than 8 minutes, and SOREM, the sleep onset rapid eye movements, you have to have more than 2 of those during the testing. And as opposed to the type 1, where the hypocretin has to be done as part of the criteria, type 2 doesn't require the hypocretin and sometimes normal. And the reason it comes to us is because they get the hallucinations, hypnagogic hallucinations. So they might come to us with that complaint. And the rapid eye movements and the REM sleep might penetrate into the wakefulness stage. And so they might come to you with a video of themselves fluttering their eyes and the eyes are moving and then they fall asleep. So you need to know a little bit about narcolepsy just in terms of diagnostic criteria. But the really important thing is it is part of the NMO spectrum disorder defining criteria. Because the aquaporin 4 channel antibody is the driver behind NMOSD, the hypothalamus is one of these NMO spectrum disorder rich areas for aquaporin 4. And so if you have symptomatic narcolepsy and optic neuritis, you really should be thinking about NMOSD. In addition, multiple sclerosis, although much less common, can also produce narcolepsy. So you need to know a little bit about narcolepsy.